topic that we'll be dealing is about the herpes virus. The herpes virus family usually consists of more than 100 number of species, mostly which are enveloped DNA viruses. And these organisms have the ability, or the characteristic feature of this organism is that it is able to cause the latent infections in the human, that is able to survive in the infected host tissue for a prolonged period of time and can get reactivated and cause the reactivation infections. So coming to the introduction part of this herpes virus, it is mostly the enveloped DNA viruses causing the latent infection in the humans. The capsid of this organism is made up of icosahedral symmetry of 162 capsomeres, which encloses a linear double-stranded DNA genome. As this is the DNA virus, it has the ability to replicate in the host cell nucleus and produces virions. And apart from this, the organism is usually an enveloped virus, and the envelope is usually made up of a lipoproteinaceous material. Here in the case of this particular virus, the lipid is usually derived from the host nuclear membrane. As this is a DNA virus, it replicates inside the host cell nucleus. While getting released, it usually acquires the lipid component of the host and produces its envelope. A modified lipid membrane is usually produced or present at the outer surface of the organism, and it is completely derived from the host cell. So once the progeny is synthesized, the lipid expresses 8 nanometer spikes which are antigenic in nature. So based upon this, the antigen, the neutralizing antibodies are usually produced inside the host cell. So it is a lipid, it has a lipid envelope, and it is an enveloped virus which can be easily recognized with the help of the antigenic surfaces which are expressed on the host cell envelope. And moreover, between the capsid and the envelope, there is an amorphous substance called as a tegument, which is mostly proteinaceous in nature, is present in this particular organism. And the size of the organism is 200 nanometer in case of the envelope virus, and in case of the naked virus, it is only 100 nanometer. It indicates that not all herpes viruses are usually enveloped in nature. Now coming to the replication part of this organism, that is the herpes virus is able to replicate inside the host cell nucleus, as the genetic material of this organism is a double-stranded linear DNA, and hence it is able to replicate inside the host cell. And while replicating, the organism has the ability to produce a cow-dry type A inclusion bodies, which can be very well identified with the help of the staining techniques in the laboratory conditions. Mostly we go with the GMZ stain or the Zank smear to identify the inclusion bodies that are produced by this organism during its pathogenesis. And because this organism is an enveloped virus and the envelope is made up of lipids, it can be easily solubilized with the fat solvents such as the ether, chloroform or biles, etc. And this organism, herpes virus, are highly heat labile in nature and has to be stored at minus 70 degrees centigrade. Now, based upon their biological property, physical property and antigenic property, these herpes virus are usually divided into 3 subfamilies. One is the alpha herpes virus, beta herpes virus and the gamma herpes virus. So each of these individuals have their own characteristic feature with which we will be able to identify the organism in the laboratory conditions. Coming to the alpha herpes viruses, these are the organism which have a short replicative cycle of about 12 to 18 hours of generation, and it has a variable host range when compared to the other type of subfamilies. And the organism has the ability to cause the latent infection mostly in the sensory nerve ganglia or sensory ganglia. As we know that this organism is a latent virus and can remain live in the infected tissue of the host for a prolonged period of time, causing the reactivation infection later on. So the important characteristic feature of this alpha herpes virus is that it causes the latent infection and has the ability to remain viable in the sensory ganglions. And now coming to the cultural characteristics, they can be identified with the help of cytopathogenic effect, and the cytopathic effect that are produced by this organism is very rapid when compared to that of the other subfamilies. Example of the organism that are included under alpha herpes virus are herpes simplex, and we have varicella zoster. zoster, which usually is a chickenpox disease. Coming to the beta herpes virus, these organisms have a very slow replicative cycle, more than 24 hours, and has a narrow host range when compared to that of the alpha herpes family. And the growth is very well seen in the fibroblast and the other cell cultures such as the HeLa cells, or you can go for the Vero cells, etc., for the isolation of this organism. But the cytopathic effect produced by this organism is very slow, and they usually forms cytomegaly, which can be identified as the cytopathic effect of this organism in the cell culture. And due to the production of this cytomegaly, cytomegaly is nothing but after development in the culture, the virus will be cell associated, and hence large cells, multinucleate giant cells are usually formed, and they can be identified. The organism included under this beta herpes virus is usually the cytomegalovirus. Next, coming to the third one, that is the gamma herpes virus. They have a very narrow host range when compared to alpha and beta, and they replicate only in the lymphoblastoid cells. That is, they have the ability to attack either the B cells or the T cell and can multiply and can transform these B cells, mostly the B cells, to produce the lymphoblastoid cells, and they have the ability to cause the latent infection in these tissues only, that is in the lymphoid tissue. And the organism that will be studying under the gamma herpes virus is Epstein-Barr virus. So based upon the three important properties, that is a biological, physical, antigenic, and growth in the cell culture, we can classify herpes virus into three subfamilies, and each of them will be will be studying in detail. So first, coming to the herpes virus, they are usually divided into 8 subfamilies, 1 to 8, and all of them have different antigenic characters, and there is no antigenic similarity within the organism, and hence we cannot see any cross reaction between this particular organism, except for herpes A and herpes B, where you can see the antigenic similarity and cross reaction taking place. So it is herpes 1 and 2 strains that usually shows the cross reaction, apart from which all of them have different antigenic characters and can be identified by the neutralizing antibodies. So coming to the herpes simplex, that is the type 1 and type 2, that will be dealing now. Coming to the introduction of this herpes simplex virus, these organisms have the ability to cause infection only to the humans, and it can be induced experimentally in some of the experimental animals, but exclusively this particular infection is only for the humans, and based upon their characteristic, based upon the type of lesion they produce, and based upon the site of multiplication, you can classify the herpes simplex virus into 1 and 2. Herpes simplex virus 1 is the one that is able to cause the lesions of the in and around the mouth, and it is usually transmitted via the direct contact or through the droplets, whereas the herpes simplex 2 virus 2 is usually transmitted via the genitals, and it is transmitted via the mostly due to venereal diseases, or it is by the venereal transmission that you can see the herpes simplex virus 2 getting transmitted. And we usually designate the herpes simplex virus 1 as human herpes virus 1, and 2 as human herpes virus 2, and 1 is the one that exclusively causes the skin lesions of the mouth, 2 is usually transmitted via the genitals, and this disease, when induced in the experimental animal, it was seen that this organism is able to produce intracerebral encephalitis and also corneal scarification that led to keratoconjunctivitis, ultimately leading to the blindness in the experimental animals. And in the cell culture, you can identify the growth of the organism by the multinucleate giant cell or syncytial formation, and the cytopathogenic effect that are produced by these organisms are very rapid. This organism can be grown in the cell culture like chick embryo chorioallantoic membrane, where the organism have the ability to produce white non-necrotizing pokes, and because there is the antigenic similarity between human herpes virus 1 and human herpes virus 2, it is very necessary for us to distinguish between these two infection so that we can go for the successful treatment aspect. So as there is a cross reaction between these two serological groups, you have to distinguish, and the distinguishing characteristic can be attained by 4 different techniques. One is, the first one is we can make use of the monoclonal antibodies which are type specific, that can go and interact only with the type of strain of the virus, either HHV1 or HHV2. So we can make use of the monoclonal antibodies to identify the or distinguish between the two important strains. Next is the growth of the organism in the cell culture, that is the chick embryo chorioallantic membrane. So in this particular cell culture, you can see the type 2 strains producing pokes which are similar to that of the variola, whereas the type 1 does not produce as such any pokes in the chorioallantic membrane of the chick embryo. Next, coming to the another important difference, how can you identify, is the type 2 strains have the ability to grow very well and replicate very well in the chick chorioallantic membrane, but whereas the type 1 is limited in its growth. Next, depending on the infectivity, type 2 strains are mostly temperature sensitive, that is with an increase or decrease in temperature, the infectivity can be inhibited. So based upon this temperature activity, you can identify the 2 different types of strains. And type 2 strains usually produces neurovirulent type of lesions or the disease in case of experimental animal, and type 2 strains are more resistant against the antiviral agents such as IUDR and cytarabines. These are all the cell culture technique by which we can classify the 2 or identify the 2 important strains of the organism, HHV1 and HHV2. Apart from that, you can go for the molecular biology techniques such as restriction endonuclease, which helps to identify the specific DNAs that are present in HHV1 and HHV2, and hence helps in distinguishing the important 2 strains. Coming to the pathogenesis of this particular infections, this infection is mostly caused in the humans, and exclusively it is a human infection, where this infection can be caused to any type or any ages of the person, mostly seen in the adults, but the primary infection is only seen in the childhood between the age of 2 to 5 years. And the source of infections is mostly the skin lesions or the secretions or the respiratory secretions. So these are the 3 most important source of infection of the particular disease, HSV1 or HSV2. And in case of asymptomatic carriers, they are the mostly or likely the source of infections to transmit the infection via the genital tract, that is able to transmit the infection of the HSV2 strains. And the transmission in both the cases is first with a direct contact in case of HSV1, and in case of the HSV2, it is usually venereal in nature. Now coming to the pathophysiology of this organism, how this organism enters the body and causes the infection, and the latent infection and reactivation infection. So the virus have the ability to enter into the body via the defective skin or the mucous membrane, where initially they multiply, which is called as a local multiplication, and later on they are carried out, they are carried with the cutaneous nerve fibers intraaxonally to the ganglia. Now, after the multiplication in the ganglia, there is a centrifugal transmission of the virus from the ganglia to the skin or the mucous membrane, where they show the production of the lesions, which are cutaneous lesion or the mucous lesion. But the important characteristic of this organism, as I told you, it causes both primary as well as the reactivation infection. And the reactivation infection is because of the ability of the virus to get become latent in the infected host cell. So here the organism have the ability to become latent in the ganglion, and they causes the reactivation infection upon getting activated due to variety of factors. So the latent infection is the organism in case of HSV1 has the ability to survive in the trigeminal nerves, and in case of the HSV strain, they usually survive in the sacral areas of the sacral nerves. Now reactivation is usually seen periodically, where the organism can become active and cause the latent infection. So the infection is again characterized recognized as the oral lesions or the genital lesions depending upon the strain of the organism. The antibodies that are produced during the primary infections are usually helpful to act upon only the primary infection, but during the secondary infection they may not be very effective, but they are thought to decrease the severity of the reactivation infection. And coming to the cell-mediated immunity is very helpful in the recovery of the diseases and also during the primary course of infections. Mostly this disease is very severe, or the herpes simplex disease is very severe in the case of HIV individual, where the immune status of the person already comes down. So it is more severe in the case of HIV individual as well as the immunodeficient individuals. Now coming to the characteristic lesions of this organism. So they are called as a typical herpes lesion, which are usually thin and umbilicated ulcers that are usually breaks down to have the tiny ulcers that are usually expressed either on the face or on the genital. So this is the characteristic lesions that are usually produced by the organism, and these lesions usually heal without scarring in the case of primary infection, and mostly it is self-limited disease, but sometimes it can be very grave in nature, causing the systemic infection involving the multiple system and causing the multiple system disorders. And in case of the recurrent infection is limited when compared to that of the primary infections. Mostly in case of the childhood diseases, it is mostly limited in nature, but when it gets reactivated, it sometimes in case of immunodeficient patient, it can become very grave and can cause a systemic involvement. And coming to the HSV1 lesions, they are mostly produced above the waist, and HSV2 produced below the waist. But the infection due to HSV2 can provide protection against the HSV1, but vice versa is not possible. And but it is not true in all cases. Again, depends upon the immune status of the host. Now coming to the clinical features, that is the clinical outcome of the disease depends mostly upon the four important characteristics or the factors. First is the site of multiplication of the organism, the age of the person, third is the immunological status of the person, and the antigenic type of the organism that is usually infecting that particular person. So based upon these four characteristics, there is the outcome of the clinical infection, and this clinical manifestation can be classified depending upon the lesions they are caused and depending upon the reactivation of the infection that is seen in the person. So first we will be dealing about the cutaneous infections. So in the case of cutaneous infection, mostly the favorable spot where the lesions are usually produced and the organism multiplies satisfactorily is on the face. On the face you can see the lesions mostly on the cheeks, chin or the forehead, and in case of the infants you can see the lesions even on the buttocks, and they are similar to that of the napkin rash. So you can identify it with the help of the lesion whether it is a herpes infection or a napkin rash. And the reactivation or the characteristic feature of the reactivation infection of this herpes simplex virus is that it produces fever, rash or the febrile herpes febrilis, or it is called as a fever blisters, which is the characteristic feature of this particular disease, and mostly seen in the febrile patient. Febrile patients are nothing but the feverish patients. And in sensitive persons who are like sensitive towards the sunlight, towards the menses periods, and towards the mental stress and all, the organism can get reactivated very easily and cause the secondary infection or the latent infections. And in case of the doctors, dentists and the nurses, you can see the herpetic whitlow, which is a painful lesion that is expressed mostly on the hands, that is on the fingers. And in the case of children who are suffering from eczema, they are more prone to the infection of eczema herpeticum. And the clinical indistinguishable picture which is produced by vaccinia viral infection is similar, and the both are designated as Kaposi's varicilliform eruptions. Now coming to the next important part where the organism has the ability to attack and cause a lesion, it is a mucosal layer. Mostly the buccal mucosa are affected, leading to the primary infection called as gingivostomatitis and pharyngitis, and the latent infection is usually the herpes labialis. And here the vesicles are usually ulcerate in nature and breaks down within 48 hours and can lead to secondary infections. Coming to the third important part, that is the ophthalmic, that is the eye area, where the organism mostly causes the infection in the developing countries. And here the organism has the ability to cause the disease, ultimately leading to the corneal blindness. And apart from that, the organism also causes acute keratoconjunctivitis, which can be by itself or via the facial herpes. So there are two factors that are responsible for the manifestation of the acute keratoconjunctivitis. Next is we have a follicular conjunctivitis, where the vesicles are usually produced at the upper part of the lid, which can be treated with the help of topical application of the antiviral agents. So apart from topical application of antiviral agents, you can also go for debridement, that is removal of any foreign particle or any pathogenic organism that is present in the wounds or the vesicles, and with the help of interferons you can eliminate this particular type of infections. And the person who are suffering from herpes infection should not be given steroids. That is, the contraindication of this disease is the administration of the steroids, which can enhance or aggravate the infection to the next level, and also can delay the healing process of this keratoconjunctivitis or the herpes infection. Apart from these infections, the very uncommon or the rare diseases that are associated with the herpes infection are the chorioretinitis and acute necrotizing retinitis, which is very uncommon but very severe when it occurs. Next is the nervous system. Next target of the organism can be the nervous system. Mostly it helps in the reactivation of the infection, and it causes like herpes simplex virus encephalitis, which is again a very uncommon disease, but it is a sporadic and acute viral infections, and the acute symptoms associated with this infection is the fever and malaise. Initially the organism was demonstrated in the nervous system by the brain biopsy. Now because it is very laborious and has very most level of the risks associated with this brain biopsy, we now have more molecular biology techniques to demonstrate the organism in the brain. So we can go for the demonstration of the herpes simplex virus DNA in the cerebrospinal fluid with the help of PCR technique. The disease is mostly self-limiting without a neurological sequel. That is, you do not find any sequel of this disease once the person recovers. But you can see in the cerebrospinal fluid there is a lymphocytic pleocytosis. Pleocytosis is nothing but abnormal increase in the number of the lymphocytes. So during this particular infection, there is a lymphocytic pleocytosis, and apart from this, the other complication associated with this organisms involving the nervous system is it can cause sacral autonomic dysfunction or transverse myelitis, and is also seen in the causation of the Guillain-Barré syndrome. Apart from that, it is the organism is also demonstrated in the Bell's palsy syndrome. So this is the nervous system and the diseases that are caused by the organism in the nervous system. Next, coming to the visceral, the organism has the ability to cause HSV esophagitis leading to dysphagia, that is difficulty in swallowing, substernal pain, and we have like constant weight loss can be seen in the person who is suffering from this particular disease. And if the respiratory tract is involved, then it can lead to tracheobronchitis and pneumonitis, and the organism is uncommon in hepatitis. And apart from that, the organism in association there is a erythema multiforme in association with the herpes virus infection, and the disseminated HSV is mostly seen involving the multiple system disorders. Now next, coming to the genital area, mostly caused by the HSV type 2, but is also seen to be caused by the HSV type 1. So it is called as a genital herpes and transmitted venerally, and hence also called as a venereal disease. In case of men, it usually causes urethritis, whereas in case of a female, it can cause the infection of the cervix, vulva or vagina. But if the organism is only limited to the cervix, the female can become an asymptomatic carrier of this particular infection and transmit the infection to the newborn baby during the normal deliveries, and hence you can go with the cesarean section to prevent the disease being transmitted to the newborns. And the primary infection is very serious, involving the systemic infection, and it also has the ability to to cause vesiculo-ulcerative lesions, and apart from that it also have the ability to cause rectal and perineal lesion in case of homosexual. There are possibilities that the cervix infection with the herpes will lead to carcinoma, but there is no evidence that has been given to prove that there is association between the organism and the carcinoma. Next, coming to the congenital the organism targeting the babies, which is called as a congenital malformation. And here this organism is can have the ability to get cause the infection of the baby by transplacental infection. That is, during the normal delivery process, the organism can cause the disease of the child, can lead to congenital malformation, and mostly the mothers who are infected with this HSV type 2 strain are able to transmit the infection to the newborn babies. And in the case of postnatal infection, it is more serious type of infection, and in neonatal herpes it usually involves the eyes, the skin and the mouth of the children, and you can see the lesions that are mostly in the children due to this HSV type 2 strains. The mortality rate of this infection is very high, and if the child survives from this disease, it can lead to neurological impairment. Coming to the lab diagnosis of this particular disease, as we know, the organism has the ability to produce the inclusion bodies in the infected tissue. You can go for the isolation, identification of the inclusion bodies, and the demonstration of the virus in the secretion. So with the help of electron microscopy, you will be able to demonstrate these two, and helps in identification of the organism. Apart from that, you can go with the cell culture techniques in order to identify the causative agent. So in case of microscopic technique, you can go with the smear, which is called as a Zhang smear. Here the lesion, the base of the lesion is usually taken to prepare the smear, on which 1% of tolverdin blue is aqueous solution of the tolverdin blue is added and observed under the microscope. So here the positive effect are mostly seen as multinucleate giant cells, faceted nuclei, and we have a homogeneous staining of the organism with a glass ground chromatin. So these are the four characteristic feature which gives a positive identification of the organism in the Zhang smear. Apart from that, you can go with the internuclear type A inclusion bodies with the help of the GMZA stain, and can be very well identified with the help of electron microscopy. But in order to distinguish between the other type of herpes virus, you have to go for the antigenic determinants of this organism to finally identify the strain of the organism. So this can be very well done with the help of fluorescent antibody technique, the organism being collected either from the vesicles or the fluid, and with the help of the fluorescent conjugating with the fluorescent dyes, you can identify the organism with the help of UV microscopy or the electron microscopy. Apart from that, you can go with the PCR technique to distinguish between the different types of strains of the viruses. Next, coming to the virus isolation. So initially the presumptive identification is given with the help of microscopic technique. Now you have to confirm the organism. So you can go with the viral isolation. In the case of the virus, this can be very well grown in the tissue culture. So initially it was a monkey or mice or chick embryo chorioallantype membrane that was used, but it is said to be insensitive towards the organism, and hence we can go for the tissue culture techniques to identify the organism. And there are different cell cultures that can be used, such as human fibroblast, HeLa cells, Vero cells, to grow the organism. And the specimen that is mostly used to grow the organism in the lab is the vesical fluid or the spinal fluid. So both of them usually demonstrate the organism can be seen in this particular fluids and can be used to grow them in the cell cultures. And you can look out for the cytopathogenic effect for 24 to 48 hours and minimum for 4 days before giving a positive or a negative result to the patient. And next, you can go with the drug susceptibility test, because the organism sometimes can be a drug resistant organism, and hence you have to go for the drug susceptibility test in order to prove whether the organism is a sensitive organism or a resistant organism. Next is differentiation between the two different types of strains, that is HSV1, HSV2. The differentiation can be done with the help of monoclonal antibodies, or you can go with the chick embryo chorioallantype membrane identification. And nowadays we have got more sophisticated techniques such as ELISA, RIA, we have immunofluorescence, complement fixation test, etc. etc., in order to differentiate the different strains of the organism. And these techniques are mostly used to distinguish between the viral DNA and the protein, and helps in identifying the strain of the organism. Next, we go with the serological diagnosis. Here, the serological diagnosis mostly aims at identifying the titer of the antibodies. Now, as there is an infection with the viral virus, the antigen induces the production of the neutralizing antibodies. So, these neutralizing antibodies are mostly seen in the primary infection. As told, they are produced to be protective against the primary infection, but during the secondary infection, they do not contribute much in the elimination of the organism, but they do cause a decrease in the severity of the infection. So during the primary infection, there is a high titer of the antibodies that are produced, which can be identified either by the ELISA technique or neutralization test or the complement fixation test. And these antibodies are of low value when we are going for the recurrent or the reinfection procedures. Next, for the treatment aspect, the chemotherapy, the treatment of this particular infection can be done with the help of topical application of the idoxuridine. Next day we can go for the acyclovir and the vidarabine for the deep systemic infections. And for the encephalitis, you can go for the intravenous acyclovirs, and valacyclovir and famciclovir are usually act as a good oral like antibiotics, or you can say antiviral agent to inhibit the infection. And in case of the organism which is resistant towards this antibiotics, you can go for the foscarnet, which is which does not have a thymidine kinase, viral thymidine kinase, which is in which the viral thymidine kinase is absent. So you can go for the foscarnet treatment for treating the herpes infections. Next important group of organism is the herpes simiae, that is called as the B virus. Now this herpes simiae virus was first isolated by Sabin and Wright in 1934, when they isolated the organism from the person who has died due to the ascending myelitis, which was caused by the bite of a healthy monkey. So the organism usually transmitted by the monkey bite, and it was isolated in the infected person who was working in that particular laboratory. The name was given as B virus because of the initials of the patient who has died from this particular disease. Now, the important characteristic feature of this disease is that it can cause a lesion similar to that of the herpes virus, and they are mostly ulcerative in nature. There is a vesicles are ulcerative in nature and mostly found in the buccal mucosa, and can be transmitted by the direct contact by handling the monkeys or by handling the cultures of the monkeys which are infected with this particular infection. Now, these are usually antigenically related with the herpes virus, and hence the antibodies are thought to protect against this particular infection, but it is not so, because as already discussed, these organism, all herpes virus, have their own antigenic characteristic and they do not cross react with the other antigen, and hence the antibodies that are produced against the herpes virus cannot protect against this B virus, and hence we have to go for the alternative treatment, which is usually in the form of formaldehyde vaccine, that is given to inhibit the infection or to prevent the infection. It is mostly a human disease, that is a B virus is a human disease called as sarcopithecine herpes virus 1. Herpes varicella zoster, that is another important group of herpes virus that is involved in the causation of the disease, that is chickenpox. So here these organisms was first isolated by von Bocquet, who demonstrated that the varicella zoster, chickenpox and the herpes zoster are the different manifestation of the same virus, and it was proved to be correct by the virological techniques and the epidemiological techniques, which showed that it is a single organism that is able to cause two different types of manifestation. That is, there is a primary infection and there is a reactivation of the infection. So the primary infection is usually the chickenpox, whereas the reactivation infection is the herpes zoster infection. So here when we go with the primary infection, as I told you, the organism is able to cause the primary infection in the form of chickenpox, whereas due to the reactivation of the viruses in immunocompromised person, you can see leading to herpes zoster, and hence the chickenpox is usually caught, whereas the herpes zoster is not able to get caught, and hence it is only the chickenpox that can be easily identified. Now, irrespective of whether the person gets infected by the herpes zoster virus or the chickenpox virus, the primary infection is only the chickenpox. Later on, during the reactivation, you can see the herpes zoster infection. And coming to the morphological structure of this organism, it is similar to that of the herpes simplex virus, and it was first isolated by the scientist Weller in the human embryonic tissue cultures, and it is very well grown in the cultures such as fibroblasts, we have amnion and the HeLa cells. The cytopathic effect produced by this organism is slow when in comparison to that of the herpes simplex virus, and is similar to that of the cytopathogenic effect that are produced by the organism. And in the cultures, this organism is cell associated and hence can be easily demonstrated. And with the help of specific antisera, we will be able to distinguish between herpes virus 1, 2 and this varicella zoster. So it is only the neutralizing antibodies or the specific antisera that helps in differentiating these type of closely related viruses. And only one antigenic type of varicella zoster virus is known to us. Now, coming to the disease, that is a varicella, which is nothing but the chickenpox. As I told you, this is a primary infection that is caused by the infection with the varicella zoster virus, and it is mostly a disease of the childhood, which is mild and common and seen in the child as a childhood infection, whereas this can be seen as a reactivation of the infection in the adult, which is more intense and more severe when compared to that of the childhood disease. Now, coming to the source of this disease, the source of the disease is only the patient who is suffering from the chickenpox virus or the herpes zoster virus. So either of these virus when infects can cause the disease, that is the chickenpox. And infectivity of this disease is mostly seen during the early stages of the disease, where the organism is spread in the upper respiratory tract. So the person is highly infectious during the initial phases of the disease, and you can also see the buccal lesion mostly during the initial phases of the disease. And the organism can also be very well demonstrated in the vesicle or vesicular fluids, and it is shed in the vesicular fluids and can also become a source of the infection. And coming to the reservoirs of this organism, there is no animal reservoir for this particular organism. Now, coming to the pathophysiology, the organism has the ability to gain an entry via the respiratory tract or the conjunctiva, where the organism usually multiplies and has an incubation period of 7 to 23 days, where after which it usually produces the lesion. And the person is only infectious during the before the 2 days of the appearance of the lesion and after the 5 days of the appearance of the lesion. So it is only this particular period the person becomes infectious in nature. And in the children, it is usually recognized as a prodromal illness, but the disease is only seen only after the appearance of the rash on the children, or the appearance of the skin lesion that usually mostly appears in the trunk first. Buccal lesions are not seen in this particular at this particular time, and the rash first appears on the trunk and leaving behind the extremities of the hands and the legs. And the evolution of the rash is so fast that we will not be able to individually identify the rash. That is, there are different stages of the rash. One is the macular rash, next we have a papular rash, vesicular rash, pustular rash, and the scab. So this is the evolution of the rash, and it is so fast that it is difficult for us to identify it individually at which point it is usually developed. So the evolution is very rapid, and the spread of the disease is also very rapid in the initial stages. And the rash or the lesion usually appears as dew drops on the skin of the person, and it usually the crops are developed within 3 to 4 days, which disintegrates or usually form the crust within the 48 hours. So it is rapid crusting is seen in this particular disease. And in case of the adult infection, is more severe, and the rash are more profuse when compared to that of the childhood infection. And here the rash can be demonstrated as hemorrhagic or they are bullous rash. So these are the two characteristic features with which we can identify the adult chickenpox. And here, when the person recovers, he has a pitted scars, but the lesions are usually painful in nature, and the person can land up to varicella pneumonia in case of immunocompromised persons. Other complication associated with this particular disease is that it can cause encephalitis or meningitis, etc., and can also lead to the secondary bacterial infection with the streptococci or the staphylococci. And in the person who are on long administration of salicylates, you can see the race syndrome being developed in case of herpes infection. But whatever it is, once a person is infected with this particular infection, he has a lasting immunity until and unless there is a deficiency in the immune system leading to the reactivation of the infection, that is herpes zoster infections. And in case of pregnancy, it becomes more complicated both for the mother and the child, the child that is being born from the infected mother. So depending upon the gestation period, it usually shows a clinical manifestation. So if the lady is affected in the initial phases, that is the first trimester of her pregnancy, the child, the baby born from this particular lady can have two types of disease. One is that the child may become asymptomatic in nature, or sometimes expresses the diseases in the form of fetal varicella syndrome. And the fetal varicella syndrome manifestations are usually circastrating skin lesions. You have the lymph that are usually not produced properly, and the hemolytic anemia can also be seen in the person with the fetal varicella syndrome. And sometimes the child can carry the infection, and the organism can become latent in the child, leading to latent varicella virus infections. Now, if the lady has developed this chickenpox before 1 week or more than 1 week of her delivery, or just before 2 days or within 1 week of her delivery, then the complications are different. Suppose if the lady is affected with this particular disease before 1 week or more than 1 week of the delivery, nearing to the delivery, there is a possibility that antibodies may be produced in the mother, and they are transplantally given to the fetus, and hence protect the fetus from the disease, and hence the baby can escape from this particular disease. But if the lady is infected 2 days before or less than 1 week before the delivery, then there are more chances that the child may develop neonatal varicella, which is more serious. And in this case, if it is not treated immediately after the birth, it can lead to pneumonia or encephalitis. And hence, immediately after the birth, the baby is usually treated with the varicella zoster viral antiserum, or you can go with the chemotherapy in the early days to prevent the baby from the death. Next is you can go with the lab diagnosis for the identification of the organism. The lab diagnosis should be completely on the clinical background, and identification of the multinucleate giant cells helps in identifying the organism in the cell culture, and the production of intranuclear inclusion bodies by this organism can be demonstrated with the help of Zhang smear, making use of the different stain. This is, you can go with the Giemsa stain, you can go with the toluidine stain, or Papanicolor stain. So these are the three stains that are used to identify the intranuclear inclusion bodies produced by the organism. Apart from that, demonstration of the viruses from the vesicle and the electron microscope also helps in identifying the organism. And next, you can go with the isolation of the virus in the cell cultures, and depending upon the CPE, that is a cytopathogenic effect that are produced by the organism, you can identify the virus. But the antigenic differences between the different strain of the organism can be done only with the help of immunofluorescence or the counter immunofluorescence technique. So in case of vesicles, you can go with the immunofluorescence technique, and in case of fluids, you can go with the counter immunofluorescence technique to identify the strain of the organism based upon its antigenic characters. Next, coming to the prophylaxis and treatment of this particular disease, live vaccine was produced by Takahashi in 1974 from the strain which is called as the Oka strain. But the drawback of this particular strain was it has to be stored at a very freezing temperature, and hence a modified form of the strain was produced by lyophilized technique. So we have a modified lyophilized strain that can survive a cold storage of about 2 to 4 degrees centigrade, and hence it is mostly used in the prevention of the particular disease, that is the chicken pox. And apart from that, we now have immunoglobulins that have been produced from the convalescing patient who is convalescing from the herpes zoster infection. So these immunoglobulins are called as the varicella zoster virus immunoglobulins, which are usually given to the person who are immunocompromised and the children who are not able to produce the immunity against this particular infection, and in the old age people whose immune system usually comes down. So in these cases where they are at more risk of developing the pneumonia, you can give this particular type of immunoglobulins to prevent the infection. And specific treatment is only given to the person who are immunocompromised and at risk of developing the pneumonia, that is the adult chicken pox. So in that case you can go with the specific treatment, and apart from that you can go with the antiviral agents such as acyclovir, famciclovir, and the other antiviral compounds to inhibit the infection. And corticosteroids are mostly contraindication and should not be given to the patient who is suffering from this infection, as it can activate the infection and leading and more making it more complex in the pneumonia. Now coming to the herpes zoster virus, as already discussed, the varicella and herpes zoster virus are the different manifestation from the same virus. So one acts as a primary infection, the other one is a latent infection. So herpes zoster, also called as the shingles or the zona disease, and the herpene is this particular word is derived from the Latin word. Herpene is to creep and zoster is to girdle. So mostly seen in the old age people and the people who had already suffered from the chicken pox, there is a reactivation of this particular disease leading to the herpes zoster infection. And usually this organism has the ability to survive in the ganglions, that is sensory ganglion, and they are usually checked by the immune system. But once the immune system comes down, the organism can get reactivated. They travel along the sensory nerve to the skin and the mucosa, where they usually produces the lesion. So it is only in the immunocompromised patient, or it's only in the patient in whom the immunity has usually come down. In that case, you can see the reactivation of the infection leading to the herpes zoster infection, that is causing the lesion on the skin and the mucous membrane. And in this particular case of infection, you can see that it is preceded by inflammation of the nerve, and hence the lesions are more painful when compared to the primary infection. In the case of this particular disease, the rash is usually unilateral in nature and it is self-limited, and usually involves the area where the organism usually survives in the sensory ganglion. The sites that are mostly preferred by the organism is the D3 and L2 and the trigeminal nerve, mostly involving the ophthalmic branch. And this particular disease usually heals within 2 weeks, but the person can have pain and paresthesia even after the recovery from the infection. The other complications associated with this disease are lower motor neuron paralysis and meningoencephalitis, herpes zoster ophthalmicus, and apart from that there is a very uncommon and a rare disease that is expressed by this organism, which is called as the Ramsay-Hunt syndrome, which involves the facial nerves. Here the organism has the ability to produce the lesion in the tympanic membrane of the and the extra-auditory canal involving the facial palsy. So here the complete face changes, looking in the similar to that was a Ramsay-Hunt, and hence this particular disease is called as a Ramsay-Hunt syndrome, which is a very rare and uncommon disease caused by the organism. The cytomegalovirus, another important type of herpes virus, which is also called as a salivary gland virus, because this organism was first demonstrated in the infection of the salivary glands. And here the characteristic feature of this particular disease is there is an enlargement of the infectious cells or infected cells with you have the intranuclear inclusion bodies that are present, which leads to the enlargement of the infected cells. And another important characteristic of this organism, it has a very prolonged period of of time when compared to the other type of herpes infection, and hence it is being classified as beta herpes virus family, that is subfamily. And this disease is mostly seen in the neonates who are immunodeficient in nature, and the disease is usually in the form of a disseminated disease, whereas in the case of a normal or a healthy child, it is mostly asymptomatic and it is self-limited. But only in the immunocompromised children you can see this particular type of infection. So here you have large inclusion bodies in the infected cells. That is the characteristic feature of this particular disease, that is the cytomegalo disease caused by the cytomegalovirus. Now coming to the history of the identification of this particular disease, it was found that in the children who had died with the congenital syphilis, when the biopsy was done with the kidneys, lungs and the other part, they found that they contain large cell enlargement of the cell was there with the inclusion bodies. So these inclusion bodies were thought to be due to the parasites or the protozoa, and hence the name that was given to these infected cells was called as Entamoeba mortinatalium. And later on it was proposed by Goodpasture and Talbot that these enlarged cells are nothing but the cytomegalia. Later on in 1926 the cytomegalia was thought to be due to the viral infection, and it was demonstrated in the experimental animal, and this cytomegalia was seen in the infected experimental animal and was isolated from the salivary gland, and hence the virus was isolated from the salivary glands. The name is given as the salivary gland viruses. Later on in 1956 this organism was successfully isolated by Smith, Rowe and Weller independently, and the pathogenic effect was also demonstrated by this organism, and hence these large nucleated cells were thought to be due to the viral infection that are caused in the immunocompromised children. And in 1960 it was Weller who gave the name as cytomegalovirus. These viruses are the largest viruses of the herpes known, measuring about 150 to 200 nanometers, and they show strict host specificity. That is, the organism which is highly specific in its species will not grow in any other cells. So they require only the particular species for their growth, and hence they are called as the strict host specificity. And this organism can be grown only in the human fibroid, but the growth of the organism in vivo condition is usually in the epithelial cells. But this epithelial cell growth cannot be seen in vitro. But for growing the organism, we can go only with the human fibroblast in the cell culture technique. The incubation period of this organism, when you want to grow this organism in the cell culture, it takes nearly about 50 days to detect the growth of the organism, and hence it has a very long period of isolation, and hence a long period of incubation. And there is no antigenic similarity with any other organism, and hence there is no cross reaction with the other organism sera. Coming to the clinical features of this particular disease, the disease is similar to that of the herpes disease, which is inapparent in nature, and it has a prolonged incubation period of time within which sometimes it can get reactivated. So we have a latency and a reactivation of this particular infection, and mostly seen as a disease of intrauterine or postnatal disease. In the case of intrauterine disease, this can lead to the fetal death, or it can cause cytomegalic inclusion disease, which is very serious complication of this particular disease, which is a generalized disease causing the infection to the infant, and the complication associated with this are the hepatosplenomegaly and thrombocytopenia purpurae along with hemolytic anemia. So apart from this, the other important complication of cytomegalovirus infection is the microcephaly. So this is the most important complication, and it is rare in nature. And the other rare complication associated with this particular disease is chorioretinitis and cerebral calcification. And in case of the children who are infected with this particular disease, it ultimately leads to the death. But if they survive from this disease, you can see a mental retardation in the children. Now coming to the mothers, the infants born to the mother who have the primary infection, it is usually the cytomegaly inclusion disease that can be seen if the mother is suffering from the primary infection. But if it is a latent infection in the mother, it can lead to chronic or subclinical diseases. And the other way which the children usually acquires this particular disease is called as a perinatal infection, which is either via the genital secretions or the breast milk or the milk. And the asymptomatic carriers are usually the older children or the adults. And here you can see a heterophile negative, antibody negative test for infectious mononucleosis. So it is usually followed by the transfusion which are contaminated with the cytomegalovirus. Next is the disease which is severe in the person is mostly in the immunocompromised person, or the person who is going for the transplant, or the person who is receiving the transplant, and the person who has cancer where the immune status completely comes down, and in the patient again who is suffering from the HIV infection where again the immune status usually comes down. So the major people at risk in this particular disease are the immunocompromised persons and the person who are donating and the person who is usually receiving this particular tissue or the organ transplant. And in case of AIDS person, as already the immune competence or the immune status of the person is down, this disease becomes more grave in the case of AIDS patient because as already discussed, this disease is most severe in the person who has low immunity or where the immune system has usually come down. Next is apart from that, these organism expresses receptor which is called as a glycoprotein receptor, which is usually compatible with the Fc portion of the immunoglobulin molecules. When they go and bind to this immunoglobulin molecule, the immunoglobulin molecule usually marks the virus or hide the virus from the specific immunoglobulins that are produced against this particular infection. So the masking of the virus is by the host own immune system against this particular virus, and hence this escapes the specific neutralizing antibodies and is able to cause the infection. Now coming to the lab diagnosis, how do we diagnose this particular disease? We can recover the virus in most of the secretion of the human, that is a urinary, saliva or the body fluids, and this secretion can be used to isolate the organism from in the human fibroblast in the cell culture technique. Apart from that, a new technique has been developed where you can see the secretions, or you can go for the centrifugal deposit from the urine to identify the organism. And coming to the antibodies usually protect the person in the primary infection, and hence increase in the titer of the antibody in the primary infection helps in identification of the disease. You can go for the serological techniques such as ELISA, complement fixation test, RIA, and counter immunofluorescence test to identify the organism. And it is very essential for us to identify the organism in case of the patient who is donating the blood or the organ. So you have to screen for the blood or the organ donor if they are contaminated with the particular infection. So antibodies are usually directed against this cytomegalovirus to eliminate the infection from the blood or the organ, and then they are usually successfully transplanted. Now coming to the epidemiology of the disease, this disease is a very slow disease and can be transmitted by the close contact, and the spread of the disease is via the different secretions from the patients which when comes in contact with the healthy person can lead to the disease. And another form of transmission is via the blood transfusion or the organ transplant, and the detection of the virus can be done in the various fluids such as the urine, the saliva, the semen, etc., the cervix, etc. And you can go for the identification of the virus from the congenital malformations or the congenital disease, and the congenital infants usually carries this infection for 4 to 5 years. This is called as a viruria, where the child is highly infectious in nature, transmitting the diseases to the other healthy individuals. Now coming to the prevention and the treatment is mostly directed, or prevention is mostly directed towards the organ transplant, immunodeficient person or the premature infants. So you have to look out for the infection and go for the treatment before going for the transplant, like a transfusion or the transplant of the organs or the tissues, and have to be taken very good care in case of immunodeficient patient and the premature infants. And you have to go for the screening before going for the blood transfusion or the organ transplant. Screening in the case of donors, and the donor is usually given with the cytomegalovirus immunoglobulins in order to eliminate the infection before they are given they are used as the donors for the transfusion or for the organ transplant. And apart from that, you can go for specific antiviral therapy with the acyclovir. So in the case of this particular disease, acyclovir only act as prophylaxis but not for the treatment aspect. For the treatment, you can go with ganciclovir and foscarnet, which are also used in the case of AIDS patient to inhibit the infection or to decrease the severity of this particular infection. No vaccine has been developed against this cytomegalovirus. Recently, a new vaccine called as live attenuated to 125 AD169 has been developed. Still, the research is going on to enhance the immunogenicity of this particular live vaccine to prevent this particular disease. Epstein-Barr virus organism or herpes which belongs to the gamma herpes virus subfamily. Here the organism has ability to cause the lymphoma, that is ability to infect the B lymphocyte and causes the lymphomas. So coming to the introduction part of this, this organism was first detected by Burkitt Herpes, studied in detail by Burkitt in 1956, who has seen that there is an unusual lymphoma seen in the children of the Central Africa, and he thought that this lymphoma is because of the mosquito-borne viral infection. Later on, many studies were carried out to identify the virus from this lymphoma, and they found that there are different viruses that were called as the passenger virus. But a virus was identified by Epstein-Barr and Achong in 1964, who demonstrated that this virus is similar to that of the herpes and has the ability to cause the lymphomas and ability to cause attack the B lymphocyte lineages, transferring it to the lymphoblastoid cell lines. And the organism has the ability to attack only the B cell. It is because of the receptor, that is the CD21 receptor, that is expressed on the B lymphocyte, that usually interacts with the viruses. So virus has the ability to identify the B lymphocyte with the help of CD21 receptor and bind to this and causes the lymphoma. So here the B cells that are attacked by the Epstein-Barr viruses usually gets transformed. Now coming to the epidemiology of the disease, this disease is ubiquitous in nature with latency and a periodic reactivation, as we can see as in the herpes viral infection. The antibodies that are produced can be seen in 90% of the individual, that usually protects them from this particular infection. But in the overcrowded areas, this disease is usually infancy disease or a childhood disease. And in the affluent countries, this disease is said to be due to the an adolescence disease or the disease that leads to infectious mononucleosis. And the source of the infection is usually the saliva of the infected person, who usually secretes the virus in the oropharyngeal secretion. And the transmission is via the intimate oral contact, which is also called as a kissing disease. Now, apart from this intimate oral contact, the disease can also be transmitted via the blood or the bone marrow transfusion. And the clinical condition of this disease is the ability to produce fever, rash, and you have a sore throat and lymphadenopathy in this particular disease. And the clinical infections can lead to infectious mononucleosis in the adult. And the organism, the Epstein-Barr virus, has the ability to form the Burkitt's lymphoma, that is usually restricted to the facial part of the infected child, and mostly seen in the immunodeficient children who does not have immunity against the different types of infections. So in that case, this EBV virus has the ability to produce the Burkitt's lymphoma by attacking the B cells, and mostly they can also cause nasopharyngeal carcinoma. So the clinical condition of this particular infections are usually four types. First is it can cause infectious mononucleosis. Second is it can cause Burkitt lymphoma. And third, in the case of immunodeficient patient, the lymphoma that are seen in the immunodeficient patient are because of this EBV viral infection. Next is in case of Chinese origin, the persons are usually susceptible to nasopharyngeal carcinoma. Coming to the pathogenesis of this particular infection, the virus has the ability to gain an entry via the cell surface receptors that are present on the pharyngeal or the epithelial cells, and the cells usually expresses CR2, which is equivalent to C3d receptor of the complement. So these are the receptors which are usually identified by the Epstein-Barr virus, and they successively grow in this particular area, that is a pharyngeal or epithelial cells, where they usually multiply locally and then enter into the bloodstream, and once they enter into the bloodstream, they go and target the B lymphocyte. Once they attack the B lymphocyte, they can bring about two changes in the B lymphocyte. One is they can make the B lymphocyte an immortalized one. They attack the B lymphocyte, become latent in the B lymphocyte and causes the polyclonal activation of the B lymphocyte and makes the B lymphocyte an immortalized one. Whereas in some of the infections, you can see the B lymphocyte being attacked by the virus, and this virus has the ability to cause a lytic infection, that is kills the B lymphocyte and releases the progeny and infects the another B lymphocyte. So the most important complication that we see over here is the immortalized B cell that are able to get polyclonally activated, produces different types of antibodies leading to the lymphoma. So the complication is mononucleosis, which is because of the polyclonal transformation of the immortalized B cells. The B cells have the ability to continuously multiply and produces the lymphocytes are of different types, and here when the B cells gets infected with the virus will express the antigen on the B cell. So now this B cell becomes a new cell which is called as a new antigen. Now towards this new antigen, the immune response developed is through the cell mediated immunity, that is the T cells. So the T cells are usually the blast line T cells, and they help in going and interacting with the new antigens, that is the B cells that are usually formed after the attack of the viruses. So these T cells are called as the atypical lymphocytes. Now demonstration of the atypical lymphocyte in the blood smear helps us in identifying the Burkitt's lymphoma or the infection caused by the EB virus, Epstein-Barr viruses. And the new antigens over here are nothing but the B cells that have been infected with the virus, which expresses the antigen on its surface. So the B cell is a completely transformed cell which act as a neoantigen towards which the T cells are produced. This atypical T cells helps in identification of the disease, and sometimes there is an intermittent reactivation of the infection which causes the clonal proliferation of the B cell producing more amount of the lymphocytes. Mostly in the case of the immunodeficient person, it can lead to lymphomas. Now in the case of hyper endemic malaria in the Africa, the reason behind this Burkitt's lymphoma affecting the children is because in this case of patients, due to the effect of the malaria, the immune system usually comes down. Now, this is the reason that the organism will have the ability to go and attack and cause the Burkitt's lymphoma. Nearly half of the lymphomas that are seen in the various individuals are because of this EB viral infection. Now there are different factors that determines the susceptibility of this particular infection, where genetic and environmental factors are the most important factor in development of this particular disease. And it is said that the nasopharyngeal carcinoma is because of the genetic and environmental factor that can be seen in the Chinese people. This organism is are the one that are usually seen in the tumor DNA, and antibodies are directed against this particular organism can be easily demonstrated. The best example of to indicate that this is a genetic disease, or the factor that is involved is genetic, is with the help of genetic X-linked lymphoproliferative syndrome, which is called as a Duncan syndrome. These individuals are more prone to EB viral infections. Coming to the disease, infectious mononucleosis, also called as a glandular fever. The disease is an acute self-limiting disease mostly seen in the non-immune individuals. The incubation period of this disease is 4 to 6 weeks, and the symptoms of the disease is fever, malaise, sore throat, and lymphadenopathy. Some sometimes there is a transient rash that can be seen in this particular disease, and the person who is on ampicillin can develop macular rash because of the immune reaction between the drug and the organism. And the organism can be seen in the common in hepatitis, and can be identified with the help of liver function test. The other complication associated with this organism is it causes involvement of the hematology, neurology, or cardiac and a splenic rupture. Now coming to the lab diagnosis of this disease, you can identify, as already discussed, the T cells that have been transformed to go and interact with the newly formed new antigens of the B cell can be identified in the blood for the demonstrative purpose. But before that, you can go for the blood test where there is an initial leukopenia, decrease in the number of the leukocyte, which is immediately followed by the leukocytosis, abnormal increase in the lymphocyte. So this is a clinical condition by which you can identify this particular disease. And apart from that, the staining is done to the lymphocyte, where you can see abnormal mononuclear cells which stains deeply with the basophilic, having vacuolated cytoplasm with the fenestrate chromatin. So this helps in identifying the disease, that is the cells that have been changed due to the EB viral infections. And apart from that, the lymphoblast T cells can also be used to identify the disease. So here we are not using the B cells, but we are using the T cells that are produced in response to the new antigens that are produced by the B cells. So you can go for identification of the T cells for identifying the disease. And recently a new type of technique has been developed, which is called as a Paul Bernal test, where you can use the inactivated serum of the individual and mix it with the 1% dilution of the sheep RBCs to identify the positive reactions. And here we make use of the ox red cells in order to confirm the reports of the Paul Bernal test. And in case of infectious mononucleosis, the antibodies can be demonstrated with the help of the ox red cells. And the next technique, now because the Paul Bernal test is more laborious, a single step method has been discovered to identify the disease, which is called as a slide agglutination test. So initially Paul Bernal agglutination test was used. Now we can go with the slide agglutination test to identify the disease. And apart from that, in the slide agglutination test, we can use the sensitized horse erythrocytes to identify this particular disease. Now this disease, in this particular disease, you can see the presence of the heterophile antibodies. So this makes us difficult to identify the disease, and hence the Paul Bernal test is more specific to identify the infectious mononucleosis antibodies, which are usually inactivated. Now apart from that, you can go with the serological techniques such as immunofluorescence, ELISA, and complement fixation test, etc., to identify the organism. So now apart from the serological techniques, you can identify the recent or the past infection with the antibody titer. Mostly you go for the identification of the immunoglobulin molecule. So the detection of the IgM molecule against the virus capsid antigen helps in identifying the disease. So presence of IgM IgM antibodies helps in identifying the recent infection, whereas the presence of IgG helps in identifying the past or the reinfection or the recent infections of this particular disease. So mostly we go for the IgM identification rather than with the IgG. Now you can also identify the antibodies against the nuclear antigen, which is called as the Epstein-Barr nuclear antigen, which is a recent phenomena, helps in easy identification of the Epstein-Barr viral infection. And the organisms can be identified with the antibodies against the early antigens of this particular disease. And mostly when the EB viral is in association with the lymphomas, and because the syndrome that are produced by the organism is similar to that of the cytomegalovirus as well as the toxoplasmosis, it is only the Paul Bernal test that helps in easy identification and the accurate identification of the Epstein-Barr viral infection. Now coming to the last part of this human herpes viruses, that is 6 and 8 viruses, 6, 7, 8 viruses. Till now we have seen about the human herpes herpes 5 viruses. So the last 3 viruses of this particular organism also have the ability to cause the human infection. So in 1986, a new type of herpes virus was identified in the lymphoproliferative disease, and this is called as the lymphotropic B virus. So the other name given to this is HHV6 virus, mostly seen in the saliva or secreted in the saliva of the infants, and mostly infectious in nature, and it has two variants, the type A variant and a type B variant, among which type B is more mild and is the one involved in the infection of the disease, which is called as the exanthema subitum. And in the old age people, it causes the reactivation of the infection, which is in the form of infectious mononucleosis. So here again the primary infection is mild, whereas the secondary infection is more severe in nature. And in case of immunodeficient people, the organism has the ability to cause pneumonia. Next is HHV7. This organism was isolated from the CD4 receptor, CD4 cells of the TH lineages. So now it is similar to that of the HIV infection and shares the similar receptor with the HIV, because HIV also attacks the CD4 cells or the TH cells. So similar virus were isolated, and they found that this is in association with the HIV virus, but it is a form of herpes virus, and the name was given as HHV7 virus. Again, this is infectious and can be transmitted via the saliva and seen in association with the most of the HIV infections. Also involved in the causation of exanthem subitum. And the last virus, that is herpes virus 8, was isolated in 1994 in the Kaposis sarcoma, which is like a complication of the HIV infection. But later on it was found that the Kaposis sarcoma, which is not related to the HIV, was found to contain this virus, which is the HHV8 virus, and hence it is called as the Kaposis sarcoma herpes virus. So these are all about the herpes viral infections.